Hello, and thank you for joining us for today's webinar, Small Practice, Big Experience, Staying Competitive While Maintaining Your Identity. I'm Adam Rubenfire, a content manager at Phreesia, and I'll be moderating today's presentation. Today, we'll discuss how small practices can provide the state-of-the-art digital-first experience that patients have come to expect from enterprise organizations and health systems while remaining independent without adding to staff burden. Our panelists will share how they're creating more touch points that build patient loyalty and reinforce their identity as a trusted pillar of their community. I think you'll find this discussion is applicable not just to smaller organizations, but to any organization looking to emphasize their role in their community, including federally qualified health centers and independent medical groups of all sizes. Before we get started, I'd like to quickly share some housekeeping notes. Attendees can submit questions at any time using the Q&A widget at the top left-hand corner of your screen, and I'll ask as many questions as time allows. In the resource widget on the left-hand side of your screen, you'll find two one-pagers, one about how Phreesia supports small practices and another about how we help federally qualified health centers. We're also including a white paper about how to become the go-to destination for care in your community and a case study about how a for-provider practice is cutting its cost to collect and offering a better payment experience for its patients. If you have any technical difficulties, please click on the help widget. It has a question mark icon and covers common issues. And since it's always one of the most frequently asked questions, this session is being recorded and you'll receive a link by the end of the week. Our session today starts with a quick introduction of our guests at Phreesia. Then we'll discuss the strengths of small and independent practices and the competitive landscape they face. Finally, we'll offer best practices for small practices looking to offer an exceptional experience before turning to our panelists to hear how they're doing just that. And speaking of our panelists, I'm thrilled to introduce our guest for today. Bernadette Canning is practice manager at Children's Medical Group, a pediatric practice located in Hamden, Connecticut. Bernadette has 12 years of experience in the pediatric world and over 25 years of experience as a practice administrator in obstetrics gynecology. Rene Wills is practice administrator at Well-Being Pediatrics in Novi, Michigan. She has been working in healthcare for 28 years, beginning as a pediatric nurse in private practice and spending the last 13 years in practice administration. We're thrilled to have you both here today. Thank you so much for joining us, Rene and Bernadette.
Thanks for having me.
Thank you, Adam.
Excellent. Let's get into it. So just before we get into our presentation, I just want to quickly introduce Phreesia. Phreesia is guided by our mission of creating a better, more engaging healthcare experience for patients, providers, and staff. At over 120 million patient visits annually, that's over 1 in 10 visits across the US. Our digital platform helps healthcare organizations enhance the patient experience, drive efficiency, and improve healthcare outcomes. We've got real-time integrations with the leading EHRs in registration, scheduling, and billing systems. We're a publicly traded company on the New York Stock Exchange, and we've been rated #1 in patient intake management by Research and Insights from KLAS 4 years in a row. Plus, our security and privacy efforts are recognized with the industry's top certifications. If at any point during this webinar you're curious about how we can help your organization, don't hesitate to fill out the request a consultation form using the drop-down on the right-hand side of your screen. We'd love to discuss how we can support you. Now, let's jump right into talking about small and independent practices. I just want to talk about why patients appreciate what these practices have to offer so we can build upon those strengths. So patients love the personal nature of a hometown practice. They love being greeted by staff who they can make a personal connection with. They love seeing doctors who they know and are easy to reach, in part because they're often seeing fewer patients. And that gives them more time to spend in the exam room. Patients can put a face to a name and place trust in these institutions. A study from LUGPA, a trade group representing independent urology practices, supports this. Their research showed patients associate independent practices with personalized care, a focus on patients' trustworthiness, and high quality care. And while consolidation has changed the way our industry looks over the past few years, smaller practices still represent an essential part of healthcare. 35% of practices that have 2 to 5 clinicians, remain independent. And according to the AMA, over half of all physicians practice in organizations of 10 or fewer physicians. And studies show providers at these practices are relatively happy. One study of independent primary care providers found a burnout rate of only 13.5%. That's compared to a national rate of 54.4%. All of this being said, disruptive business models have changed the environment that these practices work within, and I want to talk about what that environment looks like. So For a while now, competition has been growing from health systems and large enterprise medical groups that have acquired practices and increasingly employed physicians. Additionally, alternative convenient care models have disrupted the industry, giving patients new options, including retail and walk-in clinics, as well as direct-to-consumer telehealth options. These organizations often offer flexible appointment availability and convenient digital tools that patients, but also parents in a pediatric practice, have come to expect from other service industries. Luckily, small practices can emulate the convenient digital-first experiences that attract patients to these models. They can match those expectations, and they don't have to burden their staff or sacrifice their independent identity. So how do they do that? Well, well-implemented technology can help small organizations provide the state-of-the-art experience without hiring a massive staff, something that is challenging not only from a cost perspective, but a hiring perspective as well. It's nearly impossible to hire new staff right now. Practices that offer self-service check-in can allow patients to check in from anywhere at any time and reduce wait times. That not only saves patients time, but staff as well. Administering digital screenings during intake can also help clinicians have more meaningful conversations in the exam room. Self-scheduling and online appointment requests are features that attract patients to large organizations because they can quickly book an appointment without picking up the phone. But luckily, the technology is readily available to small practices who can configure platforms like Phreesia to match provider preferences. Our referral tool also helps specialty practices digitize referrals, communicate with referred patients, and get them scheduled promptly. The payment process is another area where we see that patients are seeking convenience. Allowing patients to keep a card on file and easily set up payment plans offers them that self-service experience that they expect. An automated schedule management tool, such as our smart waitlist, can help your practice offer patients flexible, prompt options for appointments, while also ensuring you're securing revenue by leaving no appointment slot open. That's being approachable, and flexible, like we said, that's what patients expect. And that allows you to automatically offer canceled or rescheduled appointments to patients in the practice to get them in sooner, because you don't necessarily have the time to make those calls, or make your way down a wait list. Patients also want to be able to quickly communicate with your office without waiting on the phone. Two-way texting allows staff to keep in touch with patients. It also allows you to resolve issues and answer questions quicker and more efficiently than calling. Finally, your practice can build upon its strong reputation as a pillar of your community, practice that people talk about, by automatically following up with patients and encouraging them to leave reviews. Together, all of these tools are a part of that full digital front door experience that patients have come to expect from their healthcare organizations and that they get from all other kinds of service organizations that they work with. Right, I am thrilled to get into our panel discussion and Q&A. I'll throw these headshots up here just for another minute, just so you can remind you who our lovely panelists are. But I'm thrilled to jump into the discussion, talk with our panelists who are using these types of tools and more. Audience, if you have questions, continue to send them in via the Q&A widget on the top left-hand corner of your screen. We'll get to as many questions as we have time for, and if we don't get to those questions, we will make sure that we get you answers, because we want to help you understand really how to improve your small practice here. So I want to start, and I'll just go ahead and take these slides down. And I want to start by learning about our panelists and their organizations. So can you tell us about your organization, including the size of your practice, the services you offer, and the patient population you serve? Rene, let's start with you.
Sure. We are a primary care pediatrics group. Right now, we have about 5,000 active patients. We see 60 to 70 patients in the office per day, and that's generally with 2.5 providers. One of our doctors will work a half a day. We are a full service practice. We certainly offer regular office visits, well-child exams. We do a lot of labs here in our office. We also offer telehealth for our patients for those visits that can be handled remotely. So we are very busy.
That's great. Bernadette, what about you?
Our practice is probably rather similar. We are a general pediatric practice. We have about 11 or 12 providers, and not all of them work full-time. Pediatrics is very flexible for being family friendly for the providers. So we probably have about 6 full-time equivalent providers, being pediatricians, physician assistants, and nurse practitioners. We offer like general, well child care, day of appointments. Pediatrics, we like to accommodate our patients so they don't go to a walk-in clinic or to the ER if possible. We offer concussion care, lactation services, and asthma care. So we try to keep as much as we can in-house.
That's great. I want to talk a little bit here about what it means to be an independent practice. And I'm just curious, Rene, I'll start with you. How do you think about your patient experience and offerings in comparison to other organizations in your area and national organizations? Like, why are you proud to be an independent practice, and what do you think you offer in that regard?
Sure. I think as an independent practice, you have a closer relationship with your patients and your parents, in our case being pediatric, but we recognize them when they walk in the door, and we remember that they have a sibling, and that sibling's name, or and you remember a lot more details, I think, when you have a smaller practice like that. It also enables us, by being an independent practice, to develop relationships with a wide variety of specialists. We're not tied down to one hospital system. We aren't required to use a certain group of doctors. So if we have those good relationships built with other practices, and we can use that to refer our patients to.
That's great. Bernadette, any other thoughts on why you're proud to be an independent practice?
Yeah, so we're in the New Haven, Connecticut area. There's a big hospital system here, and there are a lot of practices that have gone to the health system. It's competitive because there's a lot of pediatric practices in our area. I think the independent practice, it's like the providers like to have the direct influence over how they practice medicine. And our providers have been able to do that. We have very different personalities and different providers, but they're very collaborative, and they take ownership in the patient experience. And pediatrics, a lot of it is about the family experience. So you're not just connecting only with the parent, but with the family, and tying that all together. Just as Rene said, knowing who they are when they walk in the door and developing those relationships. So you have, parents that have had their care in this practice come back and bring their babies to us. And we've had that experience.
Wow, that's really special. And Bernadette, I want to stay with you for our next question, because, we have this question that we're getting from the audience around, trying to attract new patients to the practice. And you mentioned that you are in a competitive space. Do you find that digital experience, the tools for intake and scheduling, payments, these types of tools are something that patients seek out?
So I would say we get patients typically two ways. So the most important one, word of mouth. So parents that are happy with their experience here, by us utilizing that and being efficient, is what is part of the experience of making parents happy. The other way we get patients is really through our website. So putting information out there, like usually it's like prenatals, like new parents will find that we get through our website. So it's important to have something that is reflective of our practice and the way our providers practice out there. And then talking to the parents once they call us, but you have to get them in the door, right? You have to get them connected. So I would say the patient experience and the word of mouth is probably the most significant one.
Hey, what about you? I know you've said that that offering virtual visits is important to you, and these kinds of digital tools. Do you see them as a draw?
Yeah, I think that, especially just in this day and age, anything that you can do online, not necessarily from a 9-to-5 perspective, is helpful. I mean, we have parents that are sending messages and requesting appointments. I see the timestamps at like 1 a.m. because they're up with their baby. So I think it's really helpful to have that access that's available at any time. And that makes it a lot easier for people to communicate with us, and then we can accommodate them. And everyone is so busy that this really just enables us to reach out to them and say, hey, we're here and we're available and we can make this work for you. So I think we just make the technology accessible.
That's great. And, speaking of text messaging, hopefully, it's not too often in the middle of the night, but I guess that it is a great access. It's a great way to encourage access and to break down barriers to access. Bernadette, I know one of the things you've talked to me about a little bit is around text messaging and other ways that you're communicating. Can you talk a little bit about how you use text messaging? I know you mentioned a little bit about your flu clinics and how you've been using text messaging with that. I'd love to just hear a little bit about your use of that.
I'm going to start with saying that we used Phreesia with, they used to offer email invites for patients, or patients would complete the intake on the pads in the office. So we still have the pads in the office if needed, but when Phreesia changed their format to a mobile format, it revolutionized the way we were able to manage our whole check-in process and the criteria. So, patients, we have it set up that patients get the appointment reminder 2 days in advance, and that comes in a text, and there's a link in the text that brings patients to the intake. And we definitely take advantage of all that's available in that. So we're able to, I might be getting ahead of myself on the explanation of stuff, but we basically pick our appointment type and age group and cue what we want the parents to answer for those visits, and that comes in the patient intake. So we were able during the pandemic to capitalize on the mobile aspects of Phreesia. So for our flu clinics, we set up a tent outside, wireless, have a wireless printer, and just everything wireless outside. So our patients that were scheduled for a flu clinic got the appointment reminder with the intake, and the intake had the flu questionnaire for the parent to complete and the vaccine information statement. The patients called when they arrived, and so someone in the office answered the phone, and we used the Phreesia dashboard with the internal text messaging. So there's two text features, the one directly to the patient surrounding the appointment and an internal one. So we were able to text the staff that was outside to alert them that a mom was here, and we were telling the parents, you're going to get a message to come down to the tent. So basically, when the nurse was ready for the patient, they used the Phreesia interface to text the parent, say, come on down to the tent. We were able to do the vitals, administer the shot, and print their immunization record, and patients were in and out in less than 5 minutes.
Wow.
We would not have been able to do that. We were able to do that entirely outside, seamless, all the information coming right into our electronic health record. It was super efficient.
There's a lot to unpack there. Obviously you're avoiding potential, infection risk, but you're also freeing up your waiting room, just ensuring that your waiting room doesn't, that can stay open and that people can be comfortable while handling the flu clinic outside. So that's fantastic. And Bernadette, you've been a customer for quite a bit, because you are right. We have over time changed the way Phreesia works, and we've gone from having our recognizable orange pads to now our Phreesia Pad X, which lets people use an existing iPad actually, and you still can use tablets. But yeah, we think mobile is the way of the future, and surveys from patients say that. So it's really good to hear that you're having that same experience, and it's really interesting to hear how you use that for the flu clinic. Rene, I'm curious. I know you've told me that you've used it a lot to keep patients up to date with changes or disruptions to the practice. Can you talk to me a little bit about how you use text messaging and other forms of communication at your practice?
Yeah, we use Phreesia. We have several different templates built for just to alert patients that there's bad traffic or construction in the area and that they need to make sure that they allow extra time to arrive. Or one of the tools that we use with Phreesia is we get an alert if a patient answers yes to some of the COVID questions. So that gives us a heads up and we can say, wait a minute, before you come into the office, we need to clarify this. We actually, at the height of the pandemic, we were seeing our sick patients outside in their cars. So by having that information ahead of time, we could make sure that our staff had the appropriate PPE and that we would go down and see those kids in their vehicles and, cut down on any kind of risk for exposure to any of our other staff or patients in the office. So that was a really helpful tool for us. We use it if people haven't registered for their appointment, we'll send them a text message. Hey, you haven't registered for your appointment today. Are you still planning on coming? Even we can send those individualized messages as well. So we use the text feature throughout the day for a lot of different purposes.
Yeah, and when you mention templates, you're talking about it's already written, so staff literally just have to kind of click it and send it.
In the morning, we'll see that the traffic's particularly bad. We have a template that's already prepared that says there's a lot of traffic on these roads near the office. Make sure that you allow extra time, and then we can choose that for all of our patients that are in office. We don't have to send it to the telemedicine patients, obviously, but we'll choose the appropriate patient group. We send it out, and then we know that everyone's been notified. It's actually helped a lot with people arriving late, so that we can keep on schedule.
That's great, because I know once you fall off schedule, it can really just trickle down. Yeah. Go ahead, Bernadette.
Based on what Rene said, it made me think of, we've used it for individual appointments, texting patients when we've had snow delays, so we can just reach out to them and say, we're opening the office late, and can you come at this time, like just to push them later in the day. Phreesia allows you to do either what they call a broadcast message, where everybody on the schedule gets the same message, or individual. And we've taken advantage of both. And we use the templates as well. It's really useful. It's not that we don't call our patients, but patients are more apt to look at their text messages than answer the phone. So we use, we haven't given up using our phone, but parents are at work or they're coming and they'll pick up their phone and look at the text message, and they like to be able to respond to us rather than to call in and have to go through the whole queue of getting the right person. So it's really nice to have that technology available.
Yeah, and if you had to call everyone, it would be near impossible, right? So that's super helpful information, Bernadette. Thank you so much. One of the things I've heard both of you talk about to me, as well as are just a really important thing for a lot of pediatric practices, is digital screenings. I'm wondering, Bernadette, maybe we can start with you, just because I know you've mentioned that you have a mixture of part-time and full-time providers. I'm wondering how screenings help you work more efficiently, given the fact that you have this limited number of full-time providers. How do screenings help your staff?
So the way that Phreesia offers the screenings and the way Phreesia allows us to queue them is very efficient. So we use the Edinburgh, postpartum depression screener. We use MCHAT, Ages and Stages, SWIC, PHQ-9, all the depression screeners, CRAFT. We also use the asthma control screener, and there's a symptom screener for concussions, Vanderbilt. So it allows our providers to follow the Bright Futures American Academy of Pediatric recommendations. And since we're primary care, these are things that primary care practices, in particular pediatrics, are measured on by the insurance companies. They're looking for us to meet the criteria to do this. But when we first started, we adopted an EHR in 2014, and we within probably 6 months we were on Freesia, because we just couldn't keep up with the input. We had to put everything in new, and it was a huge lifesaver for us. So we started to adopt the technology, and actually the first screener that we implemented was PHQ-9, and it was something that pediatricians were encouraged to. I think all primary care providers are encouraged to do it, and the providers were very concerned about how they were going to meet this criteria, and it's seamless. So for the PHQ-9s, we actually do those when the patient arrives. That's the one screener that we don't queue in advance. That the rest of the screeners we queue based on appointment type and age. So we are able to meet those criteria. But when the patient completes the screener, it is scored, legible, and it comes right into the encounter. So before the provider walks into the room, they have that information. And even when we were new at this, and I was asking the providers, does this really make a difference? How does this impact you? So the whole thing for pediatrics is that these are screening tools. It's not, the defining test. And one of my pediatricians really explained it to me best. She was like, so for example, in MCHAT, they're looking for developmental issues. She's like, the parents spend all their time with the children. I am going to see the patient for half an hour, and I'm talking to them. I'm doing a physical exam. So even though I ask the questions, the parents observe differently. So based on the way the parent answers those questions is going to change my conversation with the parent. So it'll help guide the conversation so they're picking up on different cues. So those screeners are very important to pediatricians. And they utilize them in their patient care of how the direction of the conversation is going to go, and whether they need to refer a patient out that day, or whether it's something they're going to monitor, discuss, and watch. But all of our providers rely on the screeners. It is very, very useful tools, and we've added tools over time.
That's fantastic. Bernadette, what about you? I mean, I think the other point to be made here is when people can do the screenings is important too. It's the difference between doing it in your office and doing it at home. Do you have any thoughts on that?
Well, I know that we send the majority of our screeners as part of pre-registration, and I think it's helpful on a couple of levels. It gives the parent a chance to complete that screener when they're home and observing their child, especially for ASQ or MCHAT. But it frees up time for the provider. They're not taking those several minutes to complete those screeners where the doctor could actually be examining and evaluating the child and talking with the parents. It also gives them the chance to review them before they're even in the room, so they can sort of plan better what their approach would be with that parent. So we use screeners every day, as Bernadette said, for so many reasons. We really use the Vanderbilts quite a bit for managing our ADHD patients. We've got both the initial forms and as well as the follow-up forms. And what I appreciate a lot is that it shows progress over time. When you're looking at the scoring of those screeners, you can see if the patient is improving. You have a measurable a number that you can look at to say, okay, look, they're on medication and they're improving, or they're not improving and we need to make a change. So it's been really helpful for us to have access to that progress over time feature that we see with a lot of the screeners.
That's fantastic. And Rene, I want to stay with you because I think when we talk about smaller organizations, one of the questions we're getting is how do you think about ROI? Return on investment? How do you, because every, I understand that every dollar matters,
Mhm.
How do you think about your return when you invest in
Sure. I mean, I actually think of it like if we didn't have Frisia, we would have to employ more people, probably 2 or maybe 3 more people. So for us, it's a great return on investment because we're able to keep that same high level of performance without additional staff, which, as you mentioned earlier, is, it's not very cost effective, but also almost impossible to come by right now. So for us, we, I always like to say we really rely on Frisia. It's like an extra employee for us. So we use it every day in so many different aspects of our practice, for scheduling and for registration and for clinical care with those screeners. So it's just a huge important part of our practice.
That's fantastic. Bernadette, what about you? What if you were talking to somebody who's trying to understand, whether they, should invest in a tool, in these kinds of digital tools, whether it can, how they can get a return, what would you say?
Yeah. Well, I have a few comments because it's hard to even remember what life was like before Frisia because it has been such a practice changing tool for us. My vision was to have our patient experience, our front desk experience be more useful and more valid. Before and even like before we went mobile, we had patients in the waiting room. We're not even back to using our waiting room, and our providers love the mobile feature so much that they don't know that we're ever going to go back to using the waiting room for patients waiting for the visits. So then it brings your patients to like scheduling their next appointment or printing out the forms that were done. And we don't have a huge staff. We rely on Frisia to do all those things. So, where it used to be that what Frisia does for us, like the checking in of the patient. I mean, when our patients arrive, we're just clicking the dashboard. On the intake, patients take a picture of their insurance card and it comes in with the registration. So like that used to happen at the front desk. All of those things are useful because it's a huge return on staff. We definitely have reduced our staff over time. The other aspect of the review of return on investment, and I don't know if it is as big an impact in other specialties than pediatrics, but we rely heavily on those screeners to help us be efficient and do our job and have the providers meet the criteria that they are required to meet. But we get paid for those screeners. So they're all billable. And the reimbursement that we get from the screeners pays for Frisia. So we're doing the screeners, we're meeting the criteria that we are required to meet from insurance companies. We're following the Bright Futures recommendations and it's paying for itself. So I think in pediatrics, it's hard to not want to embrace this technology.
Yeah, it's a really important part of a lot of different primary care specialties, and it's absolutely important to quality programs with a lot of the national organizations. So thank you so much, Bernadette, for that. That's a great point. And I do want to stay with you. And we kind of talked about this a little bit as a group before we got on this webinar today. That you have some interesting ways that you're using digital intake tools to fill out school forms, which I know can be a little bit of a burden on staff. So can you tell us a little bit about what you've developed with your team?
Absolutely. So every state has school forms that are required for different grades of school entry and to play sports. And it is the bane of a pediatric practice's existence. That doesn't happen in other specialties. I worked in OBGYN. We never saw those forms. So when I started here, starting in August, you'd walk out and there would be piles of charts 30 high, easy, 10 piles. And the more you did them, the more that came through the door. We would have to hire extra staff to fill out the forms, and then the providers would have to review and sign off.
Wow.
So, I'm a firm believer in looking at like the things that are the biggest things that take up time and are repetitive. So, I kept trying to think about how we could handle this. And I went to my Freesia person, and I'm like, can you do something custom for us? And it took a little bit of time, but Freesia was able to customize a form that mimics the Connecticut state school form. So like the fields are in the same places. They pull in all of the demographic fields, so the parents don't have to enter those for the child. And it only asks the parents the questions that we don't have filled out in another field through Freesia. So like the name of the school, what grade they're in, like if the child's taking any medications, and there's drop downs for that. So it makes it really, really easy. We queue these with the well child visit starting at age 5 through high school age. So it comes in, it's legible, and it comes right in through Freesia, imports right into Athena. So our providers have a form that they fill out in Athena. So at the end of the visit, like we print out the page that came in from Freesia, completed by the parent, the physical exam and screening page, and the immunizations, and then they're stored in Athena. So throughout the year, if the parent misplaces the copy, they don't have to be redone. Like we just print them. When I say we do a lot of these, we probably do 6,000 a year. So to be able to automate this and have the parents fill it out when they're doing the intake is monumental. Parents love it. The staff loves it. I mean, like, I can't tell you how many how time consuming it was. And to have this be automated is fantastic. And when the parent goes, like when the kid comes in for their well child the next year, now they're 8 instead of 7, they only have to update the grade if they change schools or if there's any health concerns. So the parent doesn't have to complete the whole thing all over again. It just cues for them. So it's really been a great feature. And that Freesia has done some other customized forms for us that have helped us. We've used different things that they've done to help achieve our PCMH recognition. And we've employed Freesia to help us on those things a lot of times. But the school forms is definitely the biggest coup. And we have not had, when we were looking at EHRs, every EHR, every pediatric practice asks if you can do this. No one does it. Nobody does it because it's different state by state. So the fact that Freesia was able to do this, our practice is set aside from any other practice in the New Haven area, like just efficiency wise. It's huge.
Wow, that's pretty great.
I'm enthusiastic, right?
Renee is going to come knocking on her account owner's door.
I got to figure out how to do that. You know, Adam, one of the things too that when you're talking about return on investment, the payment collection through Freesia is phenomenal. Our patients can pay ahead of time. They can use the storing a card on file option. And so not only is it easier for the parent, you're not trying to wrangle your kid while you're getting your credit card out. You can do it all ahead of time. Also pay any balance or set up payment plans if you need to. But that's helpful for our staff. They're not having to pause and collect that payment as well. So that's just another feature that I think is really helpful.
That's great. Yeah. I mean, Renee, I do want to start, we do need to close out. We're getting to the end of our time, but so I will ask you one more question. And Bernadette, I'll ask you this as well. You know, if we're talking to a small practice that's trying to, compete at that level that we've been discussing today, Renee, what would you like what's the one thing they should start prioritizing tomorrow and start thinking about as
Sure.
they get on that journey?
I think that even when you're a smaller practice, you still have to be able to offer all of those same levels of care that a bigger practice could do. We still have to meet all of those quality measures, and they have to be measurable. We need to be able to say, hey, we are doing all of these screeners. We are having our patients complete the PCMH acceptance forms, and we can do that through Freesia, and we can provide a report that says, hey, it's done. So you're able to get that uplift. We With that technology, we can make it easier for our patients to register and schedule and be prepared for their visit. So even though you're a smaller group with a smaller staff, you have the technology to make yourself seem like a big practice or a big group, with being able to accommodate your patients. So just got to think big, even from a smaller perspective.
I mean, that's basically the title of this webinar. So that's great. Bernadette, what about you? Close us out.
Yeah, so definitely I would say embrace technology. Exactly what Rene says. Technology allows us as a small practice to function equally as well, if not better, than bigger practices. We're able to stage and add those things as they become available. For us, a lot of it has been our PCMH journey that Freesia not only does Freesia allow us to meet all the criteria with developmental screening and PHQ-9s, we use the survey data. We do SDOH screening, and we can offer resources. There's a lot of things that Freesia offers us, and as we're adopting as it becomes available that works for our practice. But I would say for a new practice, Freesia saves time, and just stage the implementation. Pick the things that are the most significant and the biggest hurdles for you, and then add in the other aspects over time. Make sure it's working and coming in, and you know what to expect. But it really enhances the whole experience. And pediatric, I think most people want to be able to do things on their own timeline. So as long as parents or patients know that this is available in non-office hours, that they can do it. When they get to the office, their whole experience is much more valuable. We're respecting our patients' time, not just our provider time. They're able to complete things when on their time frame. So when they get to the office, we can value their time that's in the office. And I think that's a gift, that we're able to do that. And we would not be able to do that without this technology.
Well, that's fantastic. And unfortunately, it takes us to the end of our presentation, but I do want to thank both of you, Rene and Bernadette. If we didn't get to your question in the chat from the audience, or if you have any questions about Freesia, again, please don't hesitate to request a consultation using the form on the right-hand side of your screen. We'd love to be in touch, and we will pass any questions we get onto our panelists here, and we can try to get you an answer. Thanks again for sharing your insights. Thanks to our audience for joining us, and have a great day, everyone. Thank you so much.